Okay, so we're ready to get started here with Debbie. We really kind of divide the actual equilibration into three parts. Our first portion, Debbie, will be regarding eliminating seated condylar position interferences. In other words, we want to eliminate all interferences to PSCP, or her physiologically seated condylar position. And that's the first thing we're going to be doing, and that probably takes the most time. Secondly, after those have been refined, we will then go in and eliminate all posterior working, balancing, and protrusive interferences. And then finally, we will refine the anterior guidance and make sure that the anterior guidance is in harmony with the envelope of function. And we will do them sequentially in that order. Okay, Debbie? Mm-hmm. And so as we start here, my choice here for most patients is to use a Brasser 7406. It's a very nice 12 fluted finishing bar. And with Debbie having very minimal amounts of reduction, we'll probably be using very much a Whitestone. Whitestones are very nice. They leave a very nice, highly polished area. They do very minimal cutting, and the nice thing about them too is we can use a honing stone or a shaping stone, and we can literally take that Whitestone, the Whitestone here, and really kind of custom shape it to however we want it to be. That works out very, very, very nicely. And so probably a lot of what we're going to be doing on Debbie is going to involve using the Whitestones, and they leave, again, a very nice, smooth, they do very minimal amount of cutting. And so we're kind of ready to get going.
Mm-hmm.
Are you ready, Debbie?
I'm
Okay.
ready.
So we're going to start out with here. And Debbie is actually doing that because she doesn't have a lot of restoration, so hopefully it'll be pretty good for you folks to see. I'm going to go ahead. I like to use these for keeping dry. These are called absorbables. They're very nice. They're rolled cotton. Much, much nicer than plain cotton rolls. Much more absorbent. And so we're going to start here with black film, please. Hey, Debbie, go ahead and chop, 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 chop. Open. Okay. And as we expected, we have our little spot right here. And again, one thing, I'll make a note here. Again. Chop, 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 chop. Open. Okay, and it's already to the point where that interference is gone. Right here. Okay, once again, in more flat. Tap, tap, tap. Again, we're picking up that interference again here. And literally, this is how we go here. Debbie, do you feel? Go ahead on your own now. Tap, 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 tap. Do you feel anything on the left side touching it at all yet?
No.
Okay, open. Okay, let's keep going. Tap, 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 tap. Open. And as I'm doing my reduction, always, I am reducing inclines. It's unusual that I will actually do any adjustment on a stop or on a cuff tip. Almost all adjusting will be done in inclines. And certainly, all interferences on inclines are eliminated before any stops or any cuff tips are touched. And as you can see, we still have maintained a very nice single point of contact on the anterior. I'm going to take that down just a little bit more here. Okay. Go ahead and chop, 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 chop. Open. Okay. Debbie, go ahead on your own now. Tap your feet. What do you feel touching? You feel anything touching at all yet?
Not on the left, not yet.
Anything on the right at all touching?
Yes, in the back.
In the back, yeah. Okay, go ahead. Go ahead and mark them. And chop, 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 chop. Open. There we go. Always when I use the term reshaping of the tooth, it's not like I'm reducing a tooth, it's a reshaping process. Always want to, again, adjust inclines typically, and also the facial and lingual surfaces. Always want to try to ultimately also affect the position of the contact in such a way as to maximize axially directed forces on the teeth. Go ahead and tap, 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 tap. Okay. Good. I don't know if you can see this, but really I have not yet touched the cuff tip. Then strictly on incline, strictly adjusting, reshaping, recontouring incline. Okay? And again, one thing I did mention earlier is always cut dry. Okay. Keeping your teeth dry is a real important quality, and if you're using a sharp instrument, cutting dry is much more efficient. Okay. Back up. Go ahead and close now. Okay. What do you feel? What are you aware of? You still on that right side?
Yeah.
Okay, open here. I'm going to close down a little more here. Good. And you want to keep changing that black film, okay, Donna? And get nice fresh film there. Cut. Okay. So do you have any sensitivity at all? Anything at all? Are you feeling anything at all?
No.
Okay. If you do, let me know, okay? Just because we're getting a little marked up here with some extraneous marks, let's change the red here. And occasionally I'll change colors. Just instead of cleaning the teeth up, I'll just change colors. Chop. Again, red film. Okay. Okay. Look at that. Chop. Open. Again, when I'm recontouring, always keeping in mind trying to reshape the tooth in such a way as to end up with the cusp tips and the flosses and the marginal ridges, the only points of contact. That's good. Okay, so that's now, Debbie, give that a feel there now. Do you feel anything on that left side touching all yet?
It's very close.
Very close. Okay.
Very close.
Okay. Now let's go. Let's get down one more little notch here. Okay. We'll refine the light posterior one more time here, and then we'll come back and we'll shift over to the left. So let me have isolation here, dry, hot, and on the right, and then we'll go over automatically to the left. Great. Good. You doing okay there? Okay. Good. Stop. No ice behind you. Okay, go ahead and mark. Cut. Good. That's fine. Cut. One more time down. Cut. Okay. Okay, let's go over to the left side now. I don't typically use anti-saladogs. Some individuals who cool braid are really big. Obviously, having a nice dry operating field is very nice. I mean, obviously, teeth mark much better when they're dry. I don't use anti-saladogs. I don't have a problem with anyone who does. But you find with cotton, that they tend to do fine. I don't have much of a problem with that at all. Picking up a little bit on the number 15 and 18 here. Okay. Tighten it in there now, please. Okay, relax your tongue there. Good. Okay, go ahead. Stop again. Tap. Again, same as on the right side, I am only adjusting incline. I have not touched any cuff tips. Tap. Okay. Good. Tap. Okay. Let's put a red on that left, okay? Again, a lot of times I'll just change colors here so you start to get all those marks, and some of them are smudges and not true contacts, and changing colors kind of verifies if they are in fact truly a contact or interference. And I think we're about ready to take our point man again down. One more time, actually, I'm going to go one more time. I got it still pretty heavy monster. Tap. Okay. Again, we're using the Parkels. What's the name of it? What's the name of the film? It's a film. Parkel brand, 16 micron. No, I'm sorry, I'm using Brassler film. It is the red and the black, 12 microns. Hegyi film, thank you. It is Parkel, right? Yeah. We just recently changed it. Good. We're off there now. Try that one more time. And I want to take a look at the anterior teeth here. What that relationship is now. I would suspect that numbers probably 6 and 27 are probably coming pretty close. Stay close down. Yeah, just a little ways straight. Just a little bit. Okay. Let's take our contact down here a little more. Go ahead and mark that with black. Let's see where I'm at there. Again, you can use a high speed for this also. I like using a disc that leaves again a nice flat surface. Good. Goes down. Okay. Let's go ahead here now. One more time. And then we're going to go with the, let's go to the right side again then. Again, in the early phases, there's not really a whole lot of feedback or conversation with the patient. As we get into the finer stages, and I'll be eliciting a lot more time for feedback from the patient. Good. Yeah, right. Chop, baby. And as far as whether I adjust lower or upper cuffs or upper teeth, it really depends on a number of factors. Ultimately, one where you're going to have the best idealized distribution of forces along the long axis, but also if there are restorative considerations. For example, if one tooth is going to be restored with a crown or full coverage restoration, obviously we're going to try to do or attempt to do the majority of the adjustment on that particular tooth. Looking good there. Chop. You okay? Any sensitivity on that, Debbie? Good. Okay. And again, very typically there's going to be very little, if any, sensitivity. Usually none at all. And on the issue of sensitivity, interestingly, I have never, and I can tell you I've done probably between 600 and 700 equilibrations. I have never, to my knowledge, created a sensitive tooth. And I would tell you that elimination of sensitivity is one of the most primary benefits that I have realized in my patients from equilibration. Even in cases where I have to sort of rough side out. Even in cases where enamel has been penetrated in the dentin. I've never ever created a sensitive tooth. And again, very typically it's going to be a very significant, if not dramatic, elimination of sensitivity. Okay. Ready? Tap them firmly. Go ahead, tap. Okay. And we're getting pretty close here. Okay. Donna, can you mark the right side? Go ahead and mark it. Good. Good.